Hello everyone, we are the student of group 2A, third year, and we are here to present brief information about the beta-lactam antibiotic, which is also known as cephalosporin. I am Suhail Alam. I am going to give a brief information about antibiotics. Antibiotics are the substances produced by the microorganisms which selectively suppress the growth or kill the other microorganisms at the very low concentration. And the mechanism of the antibiotic is it interferes with the cell wall synthesis or maintenance. It also interferes with the with nucleic acid synthesis, interferes with the protein synthesis. Some antibiotics here are beta-lactam antibiotic, penicillin, cephalosporin, and vancomycin.
Now I will give a brief description on cephalosporins. Cephalosporins are a class of semi-synthetic beta-lactam antibiotics, which means that they possess a molecular structure consisting of a four-membered beta-lactam ring fused to a dihydrothiosin ring. Cephalosporins are derived from a fungus known as Acremonium chrysogenum. All cephalosporins have the same mode of actions as their beta-lactam counterparts like penicillin, that is, they disrupt the synthesis of their peptidoglycan layer forming the bacterial cell wall. However, they bind to different proteins than those which bind to penicillins, so they are preferably prescribed to those patients who are allergic to penicillin.
Now I will tell you about the cephalosporins. Cephalosporins are the first generation drugs. These are used in the Klebsiella infection. Cephalosporins are also used in the treatment of the gram-positive and gram-negative bacterial infection, and also in the patient with regarding to the allergy of penicillin. And the examples of the cephalosporins are the cephalothin and cephalaxin.
Second generation drugs, cephalosporin, are used in urinary tract infection and gonococcal disease. Cephalocolor is used in otitis media and sinusitis in patients with penicillin allergy. Cefuroxime and cefamandrol are used in pneumonia.
Third generation drugs. Cephalosporins have been proved useful for meningococci, pneumococci, Haemophilus influenza, and enteric gram-negative bacilli. In general, these can be used in infection caused by organisms that can resist to the first generation and second generation cephalosporins.
In fourth generation, cephalosporins, cefepime is useful against beta-lactams producing organisms and pseudomonal infection, but in cefirum is useful against serious and resistance hospital-acquired infection.
Now I will tell the uses of cephalosporin. First generation cephalosporin are alternative to penicillin and are used in the cases of upper respiratory and cutaneous infection, while third generation cephalosporin like ceftriaxone and cefotoxin are used in the cases of curing of urinary tract and soft tissue infection. While in the case of gram-negative bacteria like Enterobacter, Klebsiella, etc.
Sometimes aminoglycosides may be combined with cephalosporin for the treatment of septicemia that are caused by gram-negative bacteria. First generation of cephalosporin like cephalosporin are administered as intramuscularly and intravenously for the treatment of surgical sepsis. For example, in case of transplanting like artificial heart valves and artificial joints.
Third generation cephalosporin like cephalosporin is combined with clindamycin from the treatment of the pyrogenic meningitis caused by Pseudomonas, and the third generation cephalosporin like cephaloxime is the first choice drug for the single dose therapy of gonorrhea caused by penicillase producing bacteria.
Nowadays, third generation cephalosporins like cephalotriaxone and cephalosparaxone are administered intravenously for the faster recovery of entity fevers like typhoid.
I'm going to now tell you about the adverse effects of the cephalosporins. Those cephalosporins are generally well tolerated, but they are more toxic than penicillins. One of the most important adverse effects is the pain, which may occur in the muscles when administered intramuscularly. Besides, it may also occur thrombophlebitis when administered intravenously.
Orally administered cephalosporins like cephalaxime may cause diarrhea due to alteration of gut ecology or irritation.
Other adverse effects of cephalosporins include hypersensitivity reactions in the form of skin rashes, angioedema, asthma, and urticaria.
So, this was our brief presentation on cephalosporins. We hope that you will appreciate it. Thank you everyone, and we would like to remind you to stay home,
Stay safe.
stay healthy.